Hi, I am Peter Glowitsky from Mayo Clinic, Editor-in-Chief of the Journal of Vascular Surgery. As we go to the press today on December 30th, 2020, more than 82 million people in the world are infected with the COVID-19 virus and almost 1.8 million died. In the United States, over 19 million people have tested positive and 338,000 died. We follow this pandemic closely, and our collection includes now more than 100 publications on COVID-19 and vascular disease. I am pleased to introduce to you today the March issue of the JVS and highlight 4 excellent papers which are freely available for the next 2 months. The Editor's Choice articles for this issue is entitled High Prevalence of Abdominal Aortic Aneurysm in Patients with Lung Cancer. It was written by Dr. Brody Wiles and colleagues from Stony Brook, New York. Among 814 patients with primary lung cancer, 11.1%, 90 patients, had an abdominal aortic aneurysm. This was significantly more than the 2% incidence of abdominal aortic aneurysm that the authors found in a matched control group without lung cancer. Patients who smoked were more likely to have an abdominal aortic aneurysm than non-smokers. In patients with a AAA, 77% had early-stage lung cancer, 12% required treatment for the aneurysm. And women had a high prevalence, 4.6% of abdominal aortic aneurysm. So the authors suggest consideration of screening high-risk populations simultaneously for both lung cancer and an abdominal aortic aneurysm. The CME article this month is entitled Timing of Repair of Blunt Thoracic Aortic Injuries in the Thoracic Endovascular Aortic Repair Era. It was written by Dr. Abdul Al-Arhayem and colleagues from Cleveland, Ohio, Bethesda, Maryland, and San Antonio, Texas. Data of 2,821 patients who underwent TEVAR for blunt thoracic aortic injury were analyzed, and the authors found that the mortality was 9.8% among those patients who were operated within 24 hours, but it was only 4.4% in those who were operated after 24 hours, and this mortality benefit persisted across injury severity groups and was independent of serious extrathoracic injuries. Based on these data, we probably should delay TEVAR beyond 24 hours after injury in those patients who have no signs of imminent rupture. The next article is by Dr. Jesse Manunga and colleagues from Minneapolis, Minnesota. It is entitled Technical Approach, Outcome and Exposure-Related Complication in Patients Undergoing Anterior Lumbar Interbody Fusion. This is based on analysis of 1,178 operations. 4.8% had exposure-related complications, including 1.4% vascular, mostly venous injuries. Close to 1% of the patients returned to the operating room because of complication. 1.7% had venous thromboembolism. 4 patients had myocardial infarctions, 2 had stroke, and 2 patients died within 30 days. So these data suggest that anterior lumbar interbody fusion can be performed safely with a relatively low rate of complications. The final article by Dr. Karishma Popley and co-authors from Richmond, Virginia is entitled anatomic suitability for commercially available percutaneous arteriovenous fistula creation systems. This retrospective study investigated the anatomic suitability and clinical usability of two FDA-approved new percutaneous endovascular systems for AV fistula creation, the Ellipsis and the Waveling Q systems. 69% of 116 upper extremities were not candidate for surgical radiocephalic fistula. Of these, 34% were candidates for one of the two systems, 32% for the Waveling and 23% for the Ellipsis system. The remaining 35% of patients were candidates for an AV fistula at the elbow or for a graft. This study concluded that there was no difference in clinical suitability between the two systems and that 34% of all patients, 1 out of 3, are suitable for percutaneous arteriovenous access creation. These were just 4 of the many excellent papers we published in the March issue of the JVS. We hope you will enjoy reading all of them. Please follow us at our website jvsresearch.org, on social media, and remember in this time of pandemic that in spite of the vaccines, still protect your patients, yourself, your family and friends from the COVID-19 virus. Thank you for watching and see you next time for the highlights of the April issue of the Journal of Vascular Surgery.